Delighted to be here today with Dr. Wayne Riley, President of SUNY Downstate Health Sciences University. On October 20th of this year, just a few short weeks ago, Dr. Riley was unanimously appointed Chair of the NYAM Board of Trustees. I could not be more proud that during my tenure as President of NYAM, I was selected the first Black chair in the 173-year history of our organization. Dr. Riley boldly and brilliantly led SUNY Downstate Medical Center, a COVID-designated hospital, through the worst of the pandemic. He's been a member of the NYAM Board of Trustees since he arrived in New York in 2017 and has helped guide us through the past 3 years. Thank you for joining us this afternoon, Dr. Riley.
Thank you, Dr. Salerno. Delighted to be with you.
Let's start off by talking about your leadership of the hospital when it was designated a COVID-19 facility by Dr. Cuomo in March of this year. You faced unique challenges in delivering patient care at the height of the pandemic in New York. What were some of the lessons that we can learn from your experience?
Well, thank you, Dr. Salerno, for mentioning that Governor Cuomo designated us very early in the pandemic, within the pandemic here in New York City and Brooklyn, to serve as a COVID-only hospital. We took that as a mark of distinction, that the governor felt enough confidence in us at SUNY Downstate as the only state-operated hospital in all of New York City, and in particular in Brooklyn, where we were hard hit. So our faculty, our deans, our clinical leadership, our nursing leadership, our respiratory therapy leadership and staff really rolled up their sleeves and really worked under some very trying circumstances that have been well documented. Our efforts were chronicled in a primetime CNN special that we're very proud of, that really told the on-the-ground experience of many of our caregivers and patients. And that was followed by a front-page Sunday story in the New York Times that really, again, highlighted the terrific work that we were able to do collectively to take care of very sick COVID patients at the outbreak of the epidemic. So what we learned is that we can rise to the occasion, that we had the resiliency that we expect of all healthcare providers, whether they be physicians, nurses, or respiratory therapists, to take care of patients in very trying circumstances. So, if I said the learning is that we were capable, we responded, and then we executed in order to save and protect lives as best as we could, given the really severe impact that COVID had in Brooklyn.
Indeed, I was very moved by the stories I heard coming out of Brooklyn. And as you know, I volunteered at Bellevue Hospital in April and May, again during the height of the pandemic. And I saw firsthand the devastating effects of the virus on families, as well as the deep disparities that it uncovered or exposed, the inequities that we knew were there. The economic toll, the personal toll, the lives the pandemic took, and followed by the subsequent racial reckoning in our country, has really opened up a conversation about systemic inequities. Share with us some of your thoughts about how we move forward as a city, state, and a country to ensure that health justice is a social good.
Well, Judy, that's a great question. I take that my role now as chairman of the Board of Trustees of the New York Academy of Medicine to help catalyze not just conversations, but concrete solutions that could be focused on systemic racism in healthcare and medicine. As much as we enjoy and have acknowledged the wonderful progress of medical science over the last 150 years in particular in the United States, we do have areas where we've not done well, where African Americans from the beginning of recorded data have never had the same level of health statistics than their fellow citizens who were not Black. That's been well documented back in the 80s in the landmark report on Black and minority health under Secretary Heckler, Marge Heckler at the time. The Heckler-Malone report, as it's known, was the first time we knew about significant healthcare disparities in our country. Now, fast forward to 2020, and here we are. Those healthcare disparities were the perfect setup for the severe impact of COVID on Black and Brown communities, in particular in Brooklyn, the Bronx, and Queens, as has been well documented. My strategy, hopefully, is that NYAM can do what it's always done, which is to embrace science, to embrace medicine, and now to do so by embracing and working on health equity issues that we know are within a few miles of where we are. So again, in being part of the policy discussion in New York City, New York State, about what can be done, how resources can be rearranged, even in the era of tight resources can be rearranged to do targeted addressing of healthcare issues. So I think this is critically important. I applaud the fellows and members and the Board of Trustees for taking on the challenge of health equity and understanding that by taking on health equity, we serve our unique and historic purpose of furthering medicine and science vis-a-vis the academy.
Well, I'm hoping that NYAM is rising to the challenge. We recently released our action agenda for health equity, which attempts to address some of these access and power issues that as we work toward everybody having the opportunity to live a healthy life. And thank you for recognizing NYAM's leadership role. How can we extend that role beyond the groups we work with and our partners here in New York City to have a broader role and be a national voice for health equity?
Well, first of all, Judy, I have to salute you. As our president and CEO of New York Academy of Medicine, you have embraced the whole equity initiative with gusto. So I salute you and thank you for your leadership to have that discussion with our board and with our fellows and members. You're right, we have to broaden our reach. We have to, as you and I have discussed, from a policy point of view, we should be more muscular in making sure that we are embracing medicine and science at a time in this country, unfortunately, where medicine and science and scientific and medical expertise are being denigrated almost on a daily basis to the detriment of the health and safety and well-being of New Yorkers, all New Yorkers, but in particular, those communities who have been more adversely impacted. So again, we have to step out our comfort zone a little bit and really delve into how we can be part of the solution, how we can put together coalitions of the willing, if you will, to work with. We can't do it alone, but we can in partnership with key individuals, key groups, both at the federal, state, and local level, and other nonprofit organizations, other foundations. We think as NYAM, as you know, we think we can play a major role. And that's where the board and I and you and the staff are going to really roll up our sleeves and put in a little bit of sweat equity to try to meet that high bar and high challenge. So this is NYAM's moment to shine. And again, my role as the chair is to do everything we can to position us to be that organization that has instant credibility, or as our young people say, the street cred, to wade into these difficult issues of medicine and public health and health equity.
Great, and we're so delighted to have your leadership and partnership in this really critical effort. Just one final question. During the pandemic, I was really struck by the toll it took on frontline workers. And I know you had many frontline workers who became ill, had all kinds of issues from lack of PPE to worrying about infecting their families to getting sick themselves. I'm worried about the mental health, the long-term effects on particularly our young house staff and young health professionals who are on the front lines. What can we do to support them? Because they're our future. They're the next generation of healthcare leaders. And what can we do now to make sure that they weather this and grow from it in meaningful ways that will support their leadership in health?
Well, Judy, I can tell you, during the peak of the pandemic in Brooklyn, I had many sleepless nights worried about our physicians, our nurses, our caregivers. I could see in their faces, the pain and the anguish and the impotence they felt to help patients who were very, very sick and deteriorated very quickly, almost before their eyes, something they had not experienced in their medical, nursing, or professional careers. So, PTSD and sort of the intense feelings and emotions that folks have are real among caregivers during this COVID era. We should never minimize that. We should acknowledge it. We should get them to talk about it. We should put together initiatives and wellness and well-being programs and opportunities for them to talk about their experience, to emote, to share their fears and their concerns. Because as you know, as a physician, part of getting our patients better, the entire patient, is that you have to look at the mental health stresses and behavioral issues that may impact their physical health. So again, this is something that we feel strongly about, that we should be mindful of.
Thank you. Want to all be aligned with helping our healers heal, as they say. So, Wayne, thank you so much for sharing some time in this conversation with me and our fellows and our members. And we look forward to a very productive and important year ahead for NYAM with your leadership. Thank you.
Great. Well, I'm honored and look forward to working with you and all the staff and our fellows and members and in other kindred spirits in our goal to make New York City and the wonderful people who live in New York City and our region healthier, happier.